My name is Michael Genovese, and I'm a board-certified psychiatrist. My responsibility at Muir Wood is to make sure that the patients there receive the best and most appropriate medical treatment that they can. At Muir Wood, we are a gender-specific program. We treat adolescent boys only. This is critical for a lot of the patients that we treat because they're able to come and get the treatment that they need without the distraction or the fear that comes along with being in a milieu with both genders. Some boys are afraid of appearing vulnerable in front of the opposite gender. So we're able to get them to express their feelings in a way that we might not be able to if they were subject to both genders being present during their treatment. Keep in mind that their brain is still developing at their age. The parts of the brain that are responsible for executive function, decision-making, mood, don't fully develop until you're about 26. So frequently the boys that we're treating are still in the midst of forming who they are. A lot of what we have to do is education. Sometimes it's more important for me to educate the boys than it is to prescribe a medication for them. Sometimes the symptoms that they report, anxiety, low mood, are things that they're going to grow out of. Also, I have to explain to them that the drugs that they might be using could be more deleterious to them than it might be to an adult because their brains haven't fully developed yet. So we can't just ask a 16-year-old to behave like a 30-year-old. It becomes more of a family affair. When we're treating an adolescent, out of necessity, we're treating a whole family. We're treating a systems issue. So the more we can involve the family, the better. When we're treating adolescent boys, we have to keep in mind that there are a lot of things that are important. Not just their mood, not just avoiding substances, but their function as well. We have to make sure that they're functioning well within their school system. We have to make sure that they're able to function well within their peer group and within their family. And we have to utilize the multidimensional approach that we use to make sure that all aspects of the patient are addressed. Sometimes parents will question whether or not to have their child enter residential treatment for substance use. It's critical to treat as soon as possible. We know that we get better outcomes the earlier that we intervene. Also, a lot of parents will minimize their child's substance use. They'll say, oh, when I was their age, I used to smoke too. I used to smoke pot once in a while. It's imperative to understand that the cannabis that's out there today is not the cannabis that was around when most parents were going to high school. The THC concentrations are much higher. The consequences of the use of today's cannabis are much higher. There are opiates around now, synthetic opiates, that weren't around when we were children, and these can be deadly. And there is a spectrum of use. And unfortunately, sometimes it starts low on the spectrum and becomes very intense very rapidly. So I recommend to parents that they intervene as soon as they can and intervene with the best treatment modality they can. And very frequently, that's residential treatment. With residential treatment, we're able to take the boy out of the environment that may be exacerbating his problem. We're able to put him into a healthy environment where he learns that he can have fun, where he can enjoy, where he can socialize with others without needing the crutch of substances. We realize that we can teach boys coping skills, life skills, social skills, responsibility in the context of a safe environment, and we can give them tools that they can take back to their home environment and then implement, that's the really important point. If you're a parent and you are searching for help for a child, it's a very difficult time to be objective. What you have to do is feel comfortable reaching out for help, speak to someone who's been through this before. And we at Muir Wood have been doing this for a long time, and we've been doing it for this population. We've been doing it for these boys. This is what we do. Let us help you help them.